Welcome to another informative video aimed at raising awareness about mental health until it becomes a regular part of our lives. Post-traumatic stress disorder, or PTSD, is a widespread psychiatric condition affecting countless trauma survivors. Historically labeled as shell shock, our understanding of PTSD has evolved dramatically over the last 40 years. The debate around PTSD's official definition from DSM-5 and ICD-11 continues to spark controversy among professionals. These two classifications differ in their approach, reflecting varying perspectives on the disorder's complexities. PTSD can manifest through various symptoms beyond fear, including emotional disturbances unique to trauma survivors. Despite advancements in treatment knowledge, many individuals suffering from PTSD remain without proper care. Statistics reveal that only 2/3 of patients receiving cognitive behavioral therapy respond adequately. Low-income regions suffer even more, with access to effective treatment significantly lacking compared to wealthier areas. Understanding the prevalence rates is crucial, with some estimates revealing up to 20% of women affected. Men also experience PTSD, albeit at lower rates, revealing gender disparities in psychiatric responses to trauma. Traumatic experiences vary in their impact, with interpersonal violence often leading to higher PTSD rates. While many recover from trauma, a substantial minority struggle with the long-term effects of PTSD. Neurobiological models suggest fear conditioning plays a key role in the development of PTSD symptoms. Individuals exposed to trauma exhibit changes in brain areas associated with fear, learning, and emotional regulation. For instance, studies reveal reduced hippocampal volumes in those diagnosed with PTSD, indicating structural changes. Understanding these neural mechanisms can guide more effective therapeutic interventions for trauma survivors. Genetic predispositions also significantly impact one's likelihood of developing PTSD after experiencing trauma. Research suggests individual differences account for 30 to 72% of the vulnerability to PTSD, emphasizing genetic interplay. Cognitive behavioral models further propose that negative appraisals of traumatic events can maintain PTSD symptoms. Individuals who perceive high levels of threat are more susceptible to experiencing prolonged distress after trauma. Commonly recommended treatments like trauma-focused cognitive behavior therapy provide a viable path for many. Though effective, these therapies must be augmented to help the 1/3 of individuals who don't respond. Innovative approaches like MDMA-assisted therapy are showing promise in enhancing patient engagement and emotional processing. The accessibility of PTSD treatment is a crucial issue that requires urgent attention from global health policymakers. Task-shifting initiatives are generating positive outcomes by training non-specialists to provide effective mental health care. Community-based models in low- and middle-income countries highlight the potential for widespread mental health interventions. Amid challenges, addressing stigma surrounding mental health can improve treatment accessibility for PTSD survivors. Enhanced understanding of complex PTSD shines a light on a distinct class of trauma survivors facing unique challenges. Delayed onset PTSD presents a significant diagnostic challenge, often surfacing long after the initial trauma event. Certain populations, including military veterans, report high numbers of delayed onset PTSD cases, complicating recovery pathways. Early intervention can limit the emergence of chronic PTSD symptoms, making timely access to care essential. Thanks for sticking with us today. If this video resonated with you or you found it insightful, show your support by hitting that like button, sharing it with someone who could benefit, and commenting below to share your thoughts.